So, here's me in my consulting room with a patient, and there's an expert there. Where's the expert?
The patient. Yeah.
Great, fantastic. So go on and tell me, what expertise does the patient have?
She'll be telling you what medication you should give her, what her symptoms are, and how to cure her.
Anything else? Does she have any other expertise? No? Zoe?
I was just thinking, she's an expert of her own body, she knows it better than the doctor does. So.
She does, which is what she said. Is she an expert on anyone else's body?
Her own body.
Anyone else's?
Other people with the same condition. No.
Any mums in this room?
Yeah,
Put your hands up. Children. Are you experts on your children?
Yeah,
Yeah?
experts on our children.
Oh, so you know about that because the children come and you tell me what's going on. So you know your children. Any other expertise?
Family members, like parents.
Parents, good, excellent, well done. Anyone else?
Mother-in-law.
Who never comes in to see the GP?
Husbands.
Hey, husbands!
My husband, I can never get to husband.
Yeah, never comes to the GP at all. You know them, don't you?
Yeah.
So the expertise that you have is not just about you, but it's about your family, and that's really, really important. Because I wouldn't have a clue about what your husband's doing or what problems there are, but you would, and that's something really important to hold on to. Because it's in whole world of confidentiality and whatnot. You sit there thinking, I must only talk about myself, but actually you do know about your family. Is there another expert in the room?
Yeah, the doctor. You have got.
Could be the doctor, could be the nurse, it could be the paramedic, could be the pharmacist, okay, the nurse. What expertise does that clinician have? Why do you choose to sit and wait to come and see what's up?
Because she's a professional. She's like she's an expert in what she does.
You've got the knowledge.
She's a female as well.
She is.
I mean, for antibiotics, the nurse can't give you that. You'd have to see the doctor.
Okay, but we'll come back to whether they can or they can't.
Nurses can. Some do.
But you said that she's a professional, right? What do you mean by that?
She's qualified in her field, basically.
What does that mean? Qualified in her field.
She studied and
What has she
She's got
studied?
her. The nurse did all that as well. It's just
She's learned medicine. So what does that mean? Learned medicine.
She knows what medicine.
She's qualified enough to give you the right medicine.
Prescribed.
And how does she do that? What does she do to do that?
Study. She listens to you.
She listens to you, and then what does she do?
Then she'll tell you if you
Examine.
need. Yeah.
Examines you. Just before she examines you, is there anything else she does? So she listens and examines. Is there anything else she does before she
she
examines?
asks you questions.
Yeah, she does. She's been trained on how to ask questions, and you might have come along with some back pain, total body pain, whatever it is. She'll ask you some questions, and she's been trained on how to ask those questions and what the relevant questions are. Then she'll examine you, and then what will she do after that?
Your prescription.
She might give you to the nurse for good.
Before she prescribes, is there anything else that she does?
She might
She'd
refer you
ask
to
if
the
you're
nurse for
allergic
good
to
tests.
She asks if you're allergic, and then what will she do? So if she prescribes something to you, why was she prescribing it?
Medication.
Yeah.
Get better.
Why? Why would she prescribe it? What's the reason?
To treat the illness.
Treat the illness. So she diagnoses, doesn't she?
Yeah.
And sometimes she doesn't know if it's a chest infection or something else, so she might send you for a chest x-ray because she doesn't know, so there might be other things that it could be that's going on. And then she'll come up with some sort of plan of action, and she'll talk to you about what that plan of action is and different options that there might be. You know, is it a chest x-ray? Is it painkillers? Is it let's wait and see for another week or two, should we give you antibiotics and things? And she's been trained in all that. Okay. Does she have any other expertise besides that?
She's a female doctor, so I'm not
She
really
is.
sure.
So female things she'll be able to talk about. But is there anything else that she knows? So if she needed to refer you to a hospital,
like psychology problems.
Specialist.
It's just your character or something like that.
They can refer you to the.
she does. Now, if she refers you, and what sort of questions are you going to ask? Have you ever been referred to a hospital?
Yeah.
Right. So when you've been referred, what does the doctor say to you?
Which hospital?
Good. Excellent. Which hospital? Does that give you a clue? What other knowledge does she have? Have any of you been to Salford Royal? So if she said, I'm referring you to Salford Royal, what would you ask?
Can we have like somewhere more closer?
Yeah? And if she says no, that's the only way there is, what else are you going to ask?
If it was emergency.
Yeah?
Urgent.
Might not be. Might not be
a
urgent.
specialist place.
In that area.
Yeah.
What people want to know is, what's it like?
Mm.
You know, what are the doctors like there? Do they care? Are they nice? And as soon as you ask that question, she'll conjure up in her own mind the last 10 patients that she's seen who've had back pain, who've been to that hospital, or chest pains, or whatever it might be. And she'll say, well, you know, from what I've heard, from the 9 patients I've seen in the last few weeks, months, or whatever it is, it seems quite good. And, you know, Tameside Hospital, obviously, most of our patients don't go to Salford, they go to Salford, Tameside, and we've heard lots of really positive stories about things.
So
Of course, we've now got a trainee who's just arrived, who, so if you pick on her brains, or your trainees, they've just been in that hospital environment and they know what it's like. So she's got knowledge of the place, the service and everything else. Now, is there another expert in that room?
The computer.
Okay, we'll come to you in a moment, Zoe, because you're going to be learning a lot more about that. What expertise does a computer have?
Internet research.
Stored a lot of information.
What sort of information?
Personal medical history.
Yes, correct. So I might not know you from Adam or Eve, but as soon as I put your name into the computer system, up comes a medical record. It shows all your problems, it shows consultations that I've had with you, consultations with the other doctors, nurses, blood test results, scans, letters back from the hospital. All that information is there for me to be able to look at. Not only that, but if I wasn't sure about how to manage your back pain, I might go to a website such as Clinical Knowledge Summaries, which is sort of nice guidance that says these are the kinds of things that you might need to think about. Or we might use GP Notebook. Zoe will be waxing lyrical about some of the things that she's going to be using from the computer to start to understand how to teach. And then it's possible that if I choose to refer you, or if she chooses to refer you to the hospital, she'll use something called e-referrals, and she might put in their back pain, and up come all the different hospitals that have appointments. And if there's an appointment there, she'll be able to book you directly into an appointment slot at a time of your choosing. And that's the expertise that the computer has. Now then, this is the clever bit. That computer screen is normally facing me, so I'm looking at it. Actually, it's not, because I have it like that, as you know, the ones who've come to see me. I have the screen turned around, so that information that the doctor or nurse is seeing, I turn it at 45 degrees so you can see the same information. And that's what I call the partnership of trust, where I'm trusting you to provide me the best information that you can about what's wrong with you and your family so I can help you. On the same time, you're trusting us to provide the best information that medicine can offer. And if we can turn that screen around so the same information that we see, you can see, then we move into this very, very exciting space, and I call that the partnership of trust. Does that make sense? Okay. Not everyone does that, and I don't want you sitting there thinking everyone's doing it, but that's very much what we've been doing to start to understand how we can help you, and you're an expert patient, so that you can look after yourself and your family better. Do you know how much people remember when they've been to see a doctor 10 minutes after they walk out the consulting room?
Nothing.
Nothing? Well, that's terrible, isn't it? It's not quite nothing, I'd like to think. Does anyone know? It's about 10%. About 10% of the information that you give. So, Zoe, when you're sitting there wax lyrically recording all this stuff because the camera needs to see that you're saying it all, just remember they'll only remember 10% of it. Or about 3 facts. And if one of them says, come back and see me in a month's time, that's 1. Take the tablet, that's 2. Take it at night time, that's 3. That's it. Everything else, out the window. You aren't going to remember it. So, but actually, if we've typed it all onto the computer, and then you can go home, and then when your partner says, what did the doctor say? Instead of trying to remember, oh, I don't know what he was talking about, but I need to go and see him in a month's time. Put the passwords in, you can actually read everything that the doctor or nurse has written. Then suddenly you can see everything. Okay, and that's what the partnership trust is all about.